What makes a fertility clinic truly patient-centered? We often talk about success rates, technology, or clinical excellence, but what about patient experience? This is what I wanted to explore with Claudia Mika as we talked about the patient-centered care certification by the European Fertility Society. Listen to this conversation to learn about what is this new certification, how does it help clinics get that seal of excellence in patient care. Join us to find out. Hi, Claudia. Thank you so much for joining me in this interview today.
Great pleasure. Hello.
Claudia, we are doing this interview because we want to tell people more about the patient-centered care clinic program certification by the European Fertility Society. And you've been heavily involved in going through this certification with the clinics that have completed it so far. So I think it's still something quite recent. But what do you think, from your perspective, is currently missing in how clinics are approaching patient-centered care?
Oh, I think many clinics claim to be patient-centered and to offer patient-centered care services, but when we look and dive deeper, then we see that there is a lot of potential for improvement. And I think this is exactly why we developed this program and certification program to help clinics to identify perhaps a few gaps, to work in the team and see where they could do better to really be patient-centered. And then at the end, to celebrate a certification for that.
And Claudia, for people who haven't heard about it before, what is the patient-centered care clinic program in simple terms?
So it's a certification program, and we have three main steps. One is that the clinic applies. Then there is some criteria to be met. One is that they should have a quality management framework. This can be an internal system, so not necessarily it must be certified or accredited. Then we expect that there's a policy on patient-centered care as one evidence that the clinic has written down what they want to stand for. Then we need to get the confirmation that they work, act, behave according to international understanding of medical ethics. And all this is then checked by us, and then a questionnaire has to be filled out. This is the self-assessment part. This is a catalog of questions, yes, no questions, where we very detailed ask for the different areas of patient-centered care. Then we go into an interview with the clinic where we ask the different department to join this interview. And afterwards, we may ask for further evidence, documents, videos, whatever evidence to round it up and to complete the certification program.
So it sounds like a very thorough process that clinics go to. And I'm mindful that most clinics might already have other certifications and accreditations that are required in the countries that they are at the moment. But how is this program different from existing certifications and accreditations they might have?
Accreditation generally looks into the general clinic setting. So they look from left to right. There's an on-site visit normally with it. And as the word or the term says, it's the patient-centered care approach. So we focus on this part, on the patient journey, the mainly non-clinical services, without ignoring the clinical services, but focusing on the non-clinical services, how the patients are approached, how communication takes place, about the education of the staff, the communication, the emotional support, how patients hands are taken through the whole process, the journey being a patient, and such a very difficult journey. I mean, this is not
Mm-hmm.
treating a disease. We are talking about a very emotional, at least for most of the patients, a very emotional process. And this is where this patient-centered care approach focuses on. And this is the difference, and this is unique worldwide. So we talk about human-centered care, we talk about patient-centered care in the overall framework, but we go really with 100 questions into the details, and every single step we try to reflect in this program.
So, whilst clinics may have a certification like an ISO accreditation or a lab accreditation, this one looks specifically at the patient care and the patient experience, which is so important for patients when they are also going through the process, but for any patient who is choosing a clinic.
Yeah, so it's complementary to each other. So it's not a competition.
Yeah,
If there is an ISO certification, it's great. So it's
yeah.
great. And in addition, clinics, if they want to qualify by a certificate confirming that they focus on patient-centered care, then this is the EFS program.
And can you walk us through what a clinic actually has to do to apply? Do they go on a website or what do they need to do?
Yeah, so they go on the EFS website and they fill out the application, and then they are contacted, and the EFS colleagues are then guiding through the system. There is the questionnaire, which I mentioned before, and step by step, yes, no, hopefully more yes than no, because this is that we expect that they have to at least fulfill 85% of those questions with a yes.
Mm-hmm.
But this is not the case. For example, from the beginning, then this questionnaire helps to identify the gaps and to work on it. So the questionnaire is provided to the clinic. They can work, they can take time. And if they say, oh, we don't have this yet, so then they can fill the gap and then they turn the no to the yes. And once they feel confident and comfortable to submit, then the questionnaire is submitted to EFS. And
Okay.
then the online interview is scheduled. And this is done by two assessors, surveyors, auditors, however we want to call it. These are qualified and trained assessors who are then guiding the clinic through a 2 hours interview. As I mentioned before, we want to talk to the CEO, we want to talk to the patient coordinator, we want to talk to the clinic's psychologist. So we have different parts scheduled in these interviews, and we are two of us, and then we go through all the points together with the clinic. Then the interview is done, and perhaps based on the interview, we would like to see more evidence, which we then ask for.
So in that interview, I think you're asking them questions, and do they need to provide any evidence? What kind of evidence would they need to provide during the interview?
So during the interview, we will not ask for documents to show them on the screen. So
Okay.
we exchange, we have seen the self-assessment beforehand, so we know about the answers. We have taken the patient's perspective before the interview, which means that we have visited the website, we have visited social media, so we have tried to get all the information a patient would look for.
Okay.
And we have, in addition, then the questionnaire, and both taken together, we try to validate the information which we had beforehand. And if there are any questions, then we may ask, as an example, can you prepare a short video showing us the reception area and the patient paths, and then they would provide this video afterwards. Or if we discuss about specific training they are referring to, then we may ask, can you please send us the annual training plan after this interview so that we can have a detailed look and don't waste time in this interview. So this is, during the interview, we may identify some of these evidences, and then this is done afterwards.
Yeah. And if we think about the process from the moment clinics go on the European Fertility Society website to apply, how long does the process typically take? I know you've mentioned that they can do the self-assessment, and if something is missing, they can improve. So I guess it's a bit variable, but from your experience, how long does it typically take?
Yeah, as exactly as you said, it can be done within a week if the patient-centered care is really implemented as it is claimed. So then the questions are very clear and the answers are given easily. If there are some gaps identified, it may take a few weeks. What I can say, once the clinic says that they are ready for the interview, then we always try to do this interview within 2 weeks, so that we find the assessors available for the interview, so that the whole process is not taking too long. And this is perhaps also another difference to accreditation, which takes much longer because it is the complete organization where policies need to be prepared because something is missing. So we want to address those clinics who want to differentiate themselves from other clinics.
And Claudia, what are some of the most common gaps that you've seen when clinics go through these assessments?
In some clinics, we saw that what we would understand as a quality management system implemented had some gaps, so that there is a good understanding of how quality is managed. There is performance indicators measured, but the overall approach, the training on it, this sometimes we saw that there is some potential for improvement. And we also see sometimes that the psychological support, the emotional support is maybe there, but there is perhaps one colleague who is then responsible for all patients, is responsible also for all staff members. So there is no backup solution in case of holidays or in case of sick leaves. So these are some minor gaps. But all in all, I really have to say that those clinics we have already assessed are doing really a great job.
And Claudia, the outcome of it, the certification, is it a binary outcome? So yes or no, you get the certification, or is there like a grading where one might be having a higher score in that certification than others?
No, we say you have to have a minimum score. And if you have this in your self-assessment, then you're eligible to go for the interview. And during the interview, the assessors confirm that all those yes answers, those criteria are met, and then the certificate is issued. But we don't say you are even better in patient-centered care than others, so we don't differentiate. We say yes or no, so it's black or white.
Okay. And in terms of the impacts and benefits that those clinics see from completing the certification, I know we've given the first few certificates at Ezra last year. Do you know what has happened to those clinics before? What sort of benefits have they gained after completing the certification?
So I think they are going in different directions. So what we heard even during the interview already was that the clinics appreciated the teamwork, working on one project, and the mutual goal to reach and achieve certification. So communicating with each other for this. So this was one benefit. Working on the self-assessment identified some gaps where they were not aware of. So let's say this is the quality, the clinic internal benefit as two examples. Then once the certificate has been achieved or the certification has been achieved, EFS helps and supports these clinics with publication in social media, on the website, specific promotional programs. And this is, of course, to spread the message, but also to attract further patients and to share that there are clinics out there who really focus specifically on patient-centered care and go the extra mile and get the stamp for this. So to cause awareness, to attract further patients who are still in the decision phase, where to go, promotion, support of branding. I think there are different types of benefits which should be considered for this.
Do you think that for patients, does this certification impact the patient's trust and their decision to go with one clinic who has the certification?
Ideally, yes. This is why we do it. We want to qualify, of course, or want to confirm the qualification of clinics. But on the other side, and this is where EFS is strongly focusing on, is the awareness, the education of patients. And so if we can bring both together, I think then definitely, yes, patients should see this as a seal of trust and should consider this for their decision, yeah.
And is the clinics that are applying, are they clinics from Europe, or is this something that is a global standard that clinics from outside Europe could potentially apply for the certification?
So at this moment, yes, we focus on Europe, but there is no reason not to go outside Europe, because when we talk about patient-centered care, we talk about humans. And although we are coming from different cultural backgrounds, patient-centered care is patient-centered care. So even if it is adjusted because we are coming from the non-European culture, this doesn't mean that there is not patient-centered care applied or used as a principle. It may be explained or some other services are included, but this is not a problem for the certification program. So is patient-centered care is universal in a way, or globally used term. Yeah.
And for a clinic who might be watching this interview and they might be saying, but we're so busy at the moment to go through this process, what would you say to them?
Prioritize. So, to be very honest, prioritize. We are all busy, and if the certification program has a priority and is a strategic goal, for example, so then the resources, the human resources mainly, will be found. Nobody should be afraid or should be concerned about that it is too much work, and there is no obligation. So apply and see if it fits and if it can fit to the current schedule, and just do it.
Yes. And is it more for larger clinics, or smaller clinics can benefit as well?
No, it's for all clinics. So a small clinic may benefit differently than a larger clinic, but in the end, the questions apply to all sizes, to all types of reproductive care clinics.
And Claudia, from your personal perspective and your experience of being through this process already with several clinics, what was a moment that stayed with you during that process with one of the teams?
I had a personal experience as a patient many, many years ago, and I felt when I went through the process as a number. So I have a personal interest in seeing clinics really following the patient-centered care approach. And when I talk in the interviews to the patient coordinator or to the leadership, and I see, because they go into very important details of the patient journey, and they can explain to us where are the differences and why they do what they do. And I feel that if they follow that, or because they follow that, a patient is not a number anymore, but it is really a patient in the center of everything around, and the hand is taken, then I really felt proud of these clinics and the people working there. So we saw that a lot of people are working at the right place, and that patients are in good hands. And this makes me personally very happy after my own experience.
Yeah, so it's a work that is personal to you.
Yeah.
And Claudia, finally, if a clinic is considering applying, what would be your advice for getting started?
Go on the website and read through the guidance and the introduction, and then fill out the application form, which is very fast, and then get in touch with EFS and start the process. And again, if gaps are identified, fill them and then go for the interview. So there is no risk in a way to fail or to lose anything. The clinic can only gain, and therefore do it.
Thank you, Claudia. That clarified so many questions, and I hope it clarified questions to those who are listening to this interview. Thank you so much for joining us today.
Thank you for your questions. Thank you.